Good morning. As always, no, not as always. I usually thank Jay and Vicki for interpreting today. So Vicki is here, but as you can see, Jay is not. This is Sarah, and so I'm looking really tall today, which I love. So thank you, Sarah, for being with us today, and thank you, Vicki, as always, for helping interpret. As we see the early signs of the first vaccines being administered in the UK, it is worth pausing to think about just how remarkable this accomplishment really is, both in the UK and in the United States and worldwide. From idea to execution, having a vaccine in less than a year is a triumph in our fight against this pandemic, a worldwide victory in our fight to save lives. However, we're not quite there yet, and so it is not a time to forget the simple science of wearing masks, washing our hands, and social distancing. It can protect us from the virus ravaging our community. And the numbers are still pretty stark in Hamilton County. It is too early to tell if the surge in infection from Thanksgiving has been reflected in the numbers. Greg will talk to that a little bit later on, but let me run through the numbers real quick. Total positive cases in Hamilton County are at 39,256. The increase from last week there is 5,872. For those of you that are following along, that is much higher than we have seen. Remember, just a few weeks ago, we were talking about how 4,000, an increase week over week of 4,000 was really high. This is quite a bit higher than that. And so the question is why? And I'm going to leave it to Greg Kesterman to talk about what that number means and what that reflects for Hamilton County. He's the expert, I'm not, but for those of you keeping track, you are correct. That is very high. The number of hospitalizations sits at 1,770. The increase week over week is 96. And the number of deaths in Hamilton County since the beginning of the pandemic is 382. The increase from last week is 6. We can't let up in these final months before the vaccine is widely available, or this winter will be far worse than it has to be. For the sake of our families, our frontline workers, our communities, we need to do the simple things required to prevent the spread of COVID-19. Yet there is hope, and vaccines are on the way. The state of Ohio has developed guidelines for vaccine distribution. Greg Kesterman, Hamilton County Commissioner of Health, and Nick Crosley, the Director of the Emergency Management Agency, are here to talk about what happens as the vaccines arrive in Hamilton County. Before we get to that, though, just a couple of updates. We are carefully and closely monitoring legislation moving through the federal government. This is the CARES Act funding that, you know, there's a bipartisan approach to providing more relief to local communities. And as we've talked before, it's been a while, we're talking about additional dollars, direct allocation to communities to prevent any kind of delay. We're talking about some flexibility so that we can address the needs as we know them in our own communities. And we're also talking about an extension for the dollars that we have already received. We don't have a lot left that has fallen to the bottom line, but we do have a little bit, especially related to testing. And so we would like to not leave that money on the table, but rather use it because the pandemic has not ended. So use it going into next year. So we are guardedly optimistic about this federal legislation. We have reached out to Senator Portman's office, to Senator Brown's office, to the congressional delegation. Just don't know how this is going to go in D.C., but fingers crossed that we do get some of the relief that has been talked about at that level. And so the last thing, before I turn it over to Greg and Nick, a quick plug for a first-of-a-kind program created to generate hope and solidarity among regional residents facing the harshest season, the winter, of the COVID-19 pandemic. So 6 local television, radio, and print news outlets are uniting to present an hour-long program called Tri-State Strong, Getting to Zero, that will run simultaneously on all outlets at 7 o'clock p.m. December 10th. It is produced by the Regional COVID Communications Center and generously supported by Procter & Gamble. So the program will be shared on TV by CPO 9, WKRC Local 12, and CET Connect. I will go slower. It will stream on the Enquirer, Cincinnati.com, and 91.7 WVXU, Radio 1 stations, which include The Wiz, 101.3 FM, Cincinnati's R&B station, and The Buzz, and also in partnership, they're also in partnership with this initiative. This first-of-a-kind media event convenes leaders in business, healthcare, and frontline hospital workers, local celebrities, and respected voices in education, sports, the arts, and faith-based organizations to share an urgent message with the public. I hope I got everybody in that. But anyway, the idea is it's a unifying message. We've got a community-wide message to remind everybody that we all play a part in getting to zero here in Hamilton County. 0 positive cases, 0 hospitalizations, 0 closures, and 0 deaths. So many thanks to all those that are involved in bringing this program to the public, and a special thanks to the media for opening it up to the airwaves. So that's all I have. I'm going to turn it over to Greg Hesterman, Hamilton County Health Commissioner, to run through the numbers and to talk about that really high increase in positive cases in Hamilton County.
Thank you, Commissioner, and good morning. So just real quick to start, yesterday the Ohio Department of Health issued a press release and made an announcement that they were adjusting how they're doing some of their reporting of cases, and that adjustment or backlog resolved 12,000 antigen tests, which contributed to some of the most recent increases that Commissioner Driehaus just referenced. I'll talk about this more in a moment when I get to our cases, but just wanted to say that up front. Our cases here in Hamilton County, when you take that out, continue to be rather plateaued. Similarly, we are continuing to see very high levels of individuals in our hospital systems and intensive care units, which is continuing to put a significant burden on those systems. Here in Hamilton County, if you do want to get tested, we do have a lot of great opportunities through the Test and Protect program, which is funded by Hamilton County. You can visit our website or the website on the screen to find locations near you. There are dozens of locations that pop up each day. In addition, on our website, there's a plethora of private providers that you can go and have your test done. Testing is significantly improved. I'm hearing individuals get their test results typically in less than 2 days, so that's fantastic. If you do get tested and you have a known exposure, remember, we are asking you to stay home so you're not spreading COVID-19. It's really important to do your role. So looking at Hamilton County's numbers, we had a solid month of significant growth in the number of COVID cases here over the last month, but the last 2 weeks have remained elevated and plateaued. Yesterday, we did have our highest number on record. We had 582 cases, although 100 of those deal with this antigen test. The state, as I mentioned, cleared a backlog of more than 12,000 antigen tests. A positive antigen test counts as a probable case if it's accompanied by a doctor's diagnosis or a close contact with confirmed COVID. Checking that information became burdensome at a statewide level in recent weeks, and the number of antigen tests coming in drastically increased as testing became more available. So they included them to better align with the Centers for Disease Control that has been doing this since August. My team will continue to monitor these numbers, but as mentioned, things do seem still to not be increasing at the rapid rate we were seeing just a few weeks ago. Today we had 480 cases that we are assigning out, so kind of right in line with that high plateau that I've been mentioning. Looking at our reproductive number, this tracks fairly closely to cases. Our reproductive number has been hovering between 0.95 and 1.0506 for the last couple weeks. Today we are at 1.07, and for the region we are at 1.05. Hospitalizations are always delayed, as it often takes a couple of days, or a couple of weeks, excuse me, for someone who gets COVID-19 to get sick enough before ending up in the hospital. The top graph represents Hamilton County hospitalizations. You can see that while we did have a few weeks back a little bit of a spike, generally speaking, hospitalizations are between 8 and 12 per day from Hamilton County. Unfortunately, when you look at the hospitalizations for the region, we are still at about 750 patients utilizing our regional hospital systems. Similarly, when I take a look at our intensive care units, we are at about 175 patients in our region's intensive care units. These numbers are continuing to put a significant strain on our medical staff and nurses and hospital systems. So all the more reason to continue to heed the public health guidance that we've been talking about for months. I want to provide an update now on quarantine. We know last week the Ohio Department of Health provided an update on quarantine requirements here in Hamilton County. On the screen there should be a slide that shows the 3 standards for quarantine. The new guidance allows for 10-day quarantine. So individuals are able to leave quarantine 4 days early if they have no symptoms. In addition, there's an option for 7-day quarantine. If you have a negative test result collected on day 5 of your quarantine or later, with that negative test result, individuals are able to leave quarantine on day 7. In all of these scenarios, public health is asking that people who are leaving quarantine early to continue to mask at all times when outside of their homes and to maintain social distance of 6 feet. In addition, it is still acceptable for a school or a workplace to require the full 14-day quarantine to be on the extra cautious side. That said, you are permitted to do the 7 or 10 days if you're thinking about leaving your home. And the last thing I want to touch base on, Commissioner Driehaus reference, deals with vaccination. We are currently under a massive planning process to make sure that we are fully ready, and it is anticipated that we'll start to see some vaccine in Hamilton County in the coming weeks. We learned last week from the Advisory Committee on Immunization Practices, or the ACIP, that the highest priority individuals to get the vaccine will be those working in the healthcare industry and those who work and live in nursing homes. The decision to vaccinate these groups was based on data. Nationally, there have been more than 250,000 confirmed COVID cases among healthcare professionals, with nearly 900 deaths. Remember, these are our frontline workers that need to help keep us safe and recovering if we get sick. In addition, the staff and those living in our nursing homes and long-term care facilities represent only about 6% of the total COVID cases, yet represent 40% of the deaths nationwide. So it's for these reasons that we are working hard to make sure that these groups are vaccinated first. The state's plan initially includes our hospital systems receiving vaccine on or around December 15th, and they will begin vaccinating the doctors and nurses that are on the front line of the response to COVID-19. In addition, the state is working through the Pharmacy Partnership for Long-Term Care Program, which includes Walgreens and CVS pharmacies. They will begin vaccinating those working and living in long-term care facilities and to get them inoculated first. Additional vaccine is anticipated weekly, and it's anticipated that by week 2, Hamilton County Public Health locally will receive vaccine, and we will begin working with our emergency responders. So our EMS, our EMTs that are frontline workers, we will start working with their departments to get them vaccinated. Once phase 1 is complete, we will receive more guidance from the federal government, but essentially phase 2 has been dedicated to those that are essential workers. This includes teachers, child care workers, police officers, firefighters, and those working in grocery stores and other critical businesses, just to name a few. So with each vaccination, we will slowly begin to end this pandemic. We are clearly a long way off, but hope is on the way. Having a significant portion of Ohioans vaccinated will help us prevent serious hospitalizations and deaths, and will ultimately allow for us to return to normal. And clearly we all look forward to this. Even with vaccine on the horizon, the tools that we have available to slow this pandemic are simple. Please always wear your mask, social distance, and wash your hands. Let us continue to work together as a community to get through this pandemic.
Thanks, Greg. As promised, we also have Nick Crosley here. He is the director of the Emergency Management Agency, and he is going to talk about the storage of the vaccine and what the county is doing related to that.
Good morning. Thank you, Commissioner. So our agency, Hamilton County Emergency Management and Homeland Security, has been actively engaged with our local public health partners to ensure that we have the capacity to store the vaccine, secure the vaccine, and get it out the door once it's received. And so, as you can see from the video we're currently showing, we made the decision based on the information that we had at the time and currently still have. We have 800,000 plus residents of Hamilton County. We needed to make sure we had enough storage. We're unique. We have 4 different health districts that we support to make sure that we had, regardless of the amount of vaccine that we receive, that we have the capacity on hand to receive and store that vaccine until it's ready to go out the door. And so at our warehouse, where we also have developed a cache of personal protective equipment, we have installed 2 walk-in coolers, a walk-in freezer, and we'll soon have 2 ultra-cold freezer units that we can display. So there are the units that we have built. So again, this allows us to receive, catalog, separate, and supply all of our public health partners. Plus, we can act as a backup storage capacity for any of our local healthcare or pharmacy partners that might need it. Here soon you'll see the ultra-cold freezer that we have in stock. And so I think as we move forward, we will continue to have this capacity. It will be here for as long as the pandemic continues. Each freezer, each refrigerator has redundant cooling capacity. We have backup power. This is our ultra-cold freezer, so this is the same model that you see and others have. That's negative 81 Celsius. This unit, as I understand, even though it looks small, can store up to 60,000 vials. Pretty soon we'll have another one so we can double that capacity. Then, of course, we have to have the personal protective equipment on hand for the staff that are going to be inoculating the public. And so we have masks, gloves, gowns, face shields, all that kind of stuff, antiseptic wipes to support our public health partners. And then concurrent with that, Hamilton County has developed the ability to have drive-through clinics, and so this is one of our tents that we've developed so that, again, we have a space for the workers to stay while cars drive through. So basically what we've done is we've looked at all the different models we've had for inoculating the public. So a lot of people use the flu clinic model. We've used our testing model, so Hamilton County has developed a testing network that does both drive-through testing as well as walk-up testing, and so we have the capacity for that as well. So I think as this continues, we will maintain and make sure this capacity stays in working order, that it's secure, and then as we move forward, we'll work with all of our health districts to store vaccine for the public.
Thanks, Nick. As you can see, this is a partnership between public health, EMA, the hospital systems, the pharmacies, and the general public and the state of Ohio and the city of Cincinnati to try to make sure that we are ready to broadly distribute the vaccine when the time comes. Greg illuminated that there is a bit of a hierarchy as to who gets that vaccine first, and as expected, hospital workers, healthcare workers, those on the front lines are first in line, as are those that are most vulnerable in our community. But we will look forward to a broad distribution here within the next few months, and I'm glad to know that we've got these 2 gentlemen working in collaboration with everybody else to make sure that that runs as smoothly as possible. So thanks to both of you. Bridget, I believe we're ready for questions.
Commissioner Scott Wortman with the Enquirer has a couple questions for both commissioners, starting with you, Commissioner Kesterman.
Good morning, Greg.
Is it me? Hold on.
I'm sorry, it is you, Scott. I'm sorry. Go ahead.
Good morning. Real quickly, too, I didn't know if, because my computer was freezing up at the beginning, it was the increase from last week in cases, was it 5,800? I couldn't make it out.
5,872.
800. Now, you mentioned that a lot of that is based on the antigen test. Have you had any indication, like, was there the feared bump from the Thanksgiving holiday, or did people largely, you think, follow the guidelines and it wasn't as bad as you thought?
I am still watching very closely, and I could be incorrect, but at this moment in time, as I look at our numbers, we did see, they're plateaued very high. And honestly, if I think Thanksgiving was going to have an impact, I would think yesterday, the last few days, we would have seen numbers skyrocket, and that has not been the case. So I am really hopeful that I am correct and that people followed our public health guidance and did a good job keeping our numbers under control.
Okay. That was my main question. Just wanted to get your take on how the holidays went, and if it's so it's the way to interpret these numbers. It's the increase is remaining steady, basically.
Yeah, that's correct. We have, as you look at our data and the hospital data, we just have so much COVID right now in our community. And so the opportunity to become ill from COVID is easy right now because it's out there. If people let their guard down and have gatherings, the opportunity for a whole bunch of people to get sick quick is very high. And so as a result, Thanksgiving, I would have expected if tons of families gave up here in Hamilton County, we would see even higher cases than we're seeing today.
You talk about how taxed the medical system is. How close to capacity are we? I mean, is it getting to the point where you are going to have to start looking at the Duke Energy Center again as a contingency?
So I can take a little piece of this, and then ultimately the majority of that question would need to go to the Health Collaborative or to some of the systems. But from what I'm hearing from hospital leadership, they are making adjustments in how they staff their facilities, and they're adjusting how many patients each nurse is seeing and doctor is seeing, and it's at an uncomfortable level right now. Their plan, though, to open up Duke has been kind of pushed back. They would rather open up other facilities here locally and make other adjustments first. So at some point in time we might see that, but first steps are adjusting here within their internal capacity.
Thank you.
Thank you. Ann Saker with the Inquirer has questions for you, Commissioner Kesterman.
Okay, thank you so very much. And again, Scott, I apologize for stepping in there. So I wonder, Greg, we did talk yesterday, but I wondered if there's been any further development of distribution plans, especially in phase 2, and who's going to be doing that level of distribution? Do you have a core of public health folks who are ready to go into, for example, the schools, or are you going to do it at, Walgreens? I'm just curious to know that next level when you start getting more deeply engaged in distribution. Yeah, what are the plans for that yet?
Certainly. We are learning more each day. Clearly, there is just so much information right now, and plans at the federal level and the state level are continuing to have to shift to ensure that we are doing the best we can with this vaccine. When we get to phase 2, I would anticipate there being a whole bunch of different partners involved. Public health will clearly play a role, and we will most likely, if we have enough vaccine to support it, open up clinics and points of dispensing where individuals who meet those criteria, those essential workers that I mentioned earlier, are able to get their vaccine. In addition, I suspect the state, as soon as possible, will start to work with some local pharmacies and others to help playing a role in vaccination. As far as stratification or levels of who gets it first in phase 2, that will come for sure from the federal level as well as the state level, and so it will take some time to tease that out and to see who gets it first. But that work is happening currently, my understanding is.
Okay, thank you, Ann. Liz Engel from the Business Courier has questions for Director Crosley.
Yeah, and this might be for Greg too. It depends on who wants to take it, but can we clarify how people will get vaccinated? I mean, are we doing drive-throughs, walk-ups, all the above, and how will people sign up?
Since I'm already standing here with my mask off, I can tell you that we are prepared for any contingency. So I think based on my discussions with public health, as you'll probably see, all of the above. And so the capacity to be able to do it in buildings, in those kind of environments, as well as having the drive-through has been developed, and we anticipate possibly using those tools. But I'll let Greg answer if he has any other comment.
Just to add on, this has been unique. Public health has been planning for inoculating large groups of people for a long time. With this pandemic, the desire to put a whole bunch of people in a small space to get vaccinated is not the right model. So we are working on some scheduling software that we could potentially use where folks could schedule their appointment when it's their turn. We are also working with many other partners to get this done. I want to reference back in 2009 when H1N1 was here, the model that was used worked really well, and we worked with our schools and set up points of dispensing actually at each school because school-age children were first to get the vaccine. We were able to vaccinate 100,000 people, just public health alone, not counting other partners, in 2009. And so we're gearing up and we're preparing. I think each community will be a little bit different. Our agency serves 45 communities. Some communities have drive-through opportunities built within buildings that we could use, and when we don't have that mechanism, as Director Crosley referenced, we have purchased some tents that will allow for folks to drive through as well. But I think a lot has to do with how much vaccine is available at any given moment in time. If we just get a few hundred doses, that would look different than if we got a few thousand doses each week. So as those numbers become more concrete, that will further adjust our plans.
I have a follow to when exactly will we have the ultra cold storage on hand?
Director Crosley indicated that we already have one of 2 freezers here at the Emergency Management Agency, and all of our hospital systems have that capacity as well.
Thank you very much. Next up, we have Corey Sharber with WVXU for you, Commissioner Kesterman.
Sure.
Hey, Greg, I just wanted to ask again about the antigen tests affecting numbers. Is this a one-time thing we're seeing, or could this happen again in the future?
It should just be a one-time adjustment. For the last 10 days, the Ohio Department of Health had an error reported on their map, and that clearing out of antigen tests removed that error and fixed the data moving forward.
And just one more question. Of course, we saw with the antigen tests 5,872 new cases within the past week. Is this on record the highest week-to-week increase the county's seen?
Including those antigen tests, it is the highest week on record, yes.
Okay, that's all the questions I have. Thank you.
I would like to add one additional item on clarification on the vaccine. I have heard that, at least from a fire chief, that it was reported somewhere that if you get the Moderna vaccine, you can get a different vaccine for your second shot. Both vaccines require that you get the same vaccination for your second shot. So it's really important that the public knows that if you get Moderna vaccine at some point, 28 days later, you need to get the same Moderna vaccine so that you're appropriately inoculated against COVID-19.
Great, thank you. Next up, we have Brian Hamrick from WLWT, and he has questions for you, Commissioner Kesterman.
Good morning.
Brian, it looks like you might be on mute.
All right, let me give that another try. How are you doing today?
Good. Good morning.
Good. I just wanted to ask you real quick. We talked about Thanksgiving, and we've been expecting this wave, and I know you talked about that briefly, but is this something you expect to come, or does it just mean that the numbers are lagging right now, or should we be seeing that at this point?
You know, it's very difficult to predict, but my belief is, similar to Halloween, we would have already started to see a significant spike in the number of cases. They remain elevated, but they are not continuing to spike up higher than where they've been over the last couple weeks. That's not to say that tomorrow and the next couple days I'm not disappointed in finding even huger numbers than I was expecting, but at this moment in time, things look fairly positive as a result of Thanksgiving.
And that gives you an indication that possibly we may have dodged a bullet here with Thanksgiving?
Yes, that's correct. And for any family who adjusted their plans, and I know there were thousands of families that made adjustments, I personally say thank you. And our hospital systems and nurses and doctors also say thank you.
Just one other thing I wanted to ask you about. When we get to this point where they go to essential workers and non-essential workers, I expect we'll get some of that information from the federal government on what is an essential worker. The other part of that is how would someone prove that they're a grocery store worker, or that, you know, a firefighter might have information that would prove who they are, but how do you get verification of if someone's an essential worker and what job they do?
The federal government will most likely release additional guidance, but some of this might also involve some vaccinating clinics at places of work. So I think some of those plans are still being developed, but at some point we will see enough vaccine that we can start doing large masses of people at the same time. So hopefully it's not confusing when we get there, but we still have a couple months to work through some of that data.
Do you have any indication of what those next schedules beyond this first phase might be? In other words, I think I heard somewhere they can make 5 million doses a week of the Pfizer vaccine. Any indication of what kind of schedule you might get after this initial December 15th?
The most I have been shared is what the state of Ohio is receiving, and I can tell you in week 1, the state of Ohio is receiving 98,000 doses of Pfizer vaccine. In week 2, they are planning to receive 200,000 doses of the Moderna vaccine. We do not know what the allocation of Pfizer will be in week 2. And then in week 3, the state is anticipating seeing 89,000 doses of Moderna, and we do not know the Pfizer allocation for week 3. So that's as far out as we know for the state of Ohio at this time.
Thank you.
And that seems to conclude our questions from reporters.
All right, thank you again. As you can see, it's rather hard to predict what's going to happen, but again, we're guardedly optimistic, and we're going to try to be as ready to go as possible, given the number of vaccines that are coming our way and the types of vaccines that are coming our way. I think there's a great deal of confidence in the people that you just heard from who are leading these agencies and leading that effort in coordination with others. So thanks again to both of you for your partnership. So one last reminder about the broadcast tomorrow, 7 o'clock tomorrow night, Getting to Zero, the part that we can all play in trying to reduce the spread of COVID-19 in Hamilton County. So thanks again for tuning in. We'll be back next week. And special thanks to Sarah for being here this morning. Tell Jay we said hey.